Today, we will discuss various types of hypertensive disorders that can occur during pregnancy. It's important for us as doctors to understand and recognize these conditions to provide proper care to our patients. Let's start with gestational hypertension. This condition refers to new-onset high blood pressure after 20 weeks of gestation in a previously normotensive woman. We diagnose gestational hypertension when systolic blood pressure is equal to or greater than 140 mm of mercury, or diastolic blood pressure is equal to or greater than 90 mm of mercury, on at least 2 occasions, 4 hours apart. In gestational hypertension, there is no presence of proteinuria, excessive protein in urine, or signs/symptoms of preeclampsia-related end-organ dysfunction, such as low platelet count, kidney problems, liver dysfunction, pulmonary edema, or neurological symptoms. Now, let's move on to preeclampsia. Preeclampsia is characterized by new-onset high blood pressure after 20 weeks of gestation in a previously normotensive woman, similar to gestational hypertension. However, in preeclampsia, we also see the presence of proteinuria. We diagnose preeclampsia when systolic blood pressure is equal to or greater than 140 mm of mercury, or diastolic blood pressure is equal to or greater than 90 mm of mercury, on at least 2 occasions, 4 hours apart. Additionally, proteinuria is confirmed if there is an excessive amount of protein in a 24-hour urine collection, a protein-to-creatinine ratio greater than 0.3, or a urine dipstick reading of 2+ or more. In some cases, a patient with new-onset hypertension without proteinuria can still be diagnosed with preeclampsia, if any features of severe disease are present. These features include severe hypertension, systolic blood pressure greater than or equal to 160 mm of mercury or diastolic blood pressure greater than or equal to 110 mm of mercury on 2 occasions, 4 hours apart, thrombocytopenia, low platelet count, impaired liver function, elevated liver transaminase levels or severe persistent pain in the right upper quadrant or epigastric area, progressive renal insufficiency, increased serum creatinine or doubling of serum creatinine, pulmonary edema, or persistent cerebral or visual disturbances. Now, eclampsia. When a patient with preeclampsia experiences a generalized seizure that cannot be attributed to other causes, we diagnose eclampsia. Moving on, we have HELLP syndrome, which stands for hemolysis, elevated liver enzymes, and low platelets. HELLP syndrome is often considered a variant of preeclampsia and is characterized by the presence of these 3 components. Next, let's discuss chronic, pre-existing, hypertension. This refers to hypertension diagnosed or present before pregnancy or before 20 weeks of gestation. If hypertension is first diagnosed during pregnancy and persists for at least 12 weeks post-delivery, it is also considered chronic hypertension. The diagnostic criteria for chronic hypertension are systolic blood pressure, greater than or equal to 140 mm of mercury or diastolic blood pressure, greater than or equal to 90 mm of mercury, based on at least 2 elevated blood pressure measurements taken at least 4 hours apart. Diagnosing these hypertensive disorders can be challenging, and a high level of clinical suspicion is crucial due to the increased risks to both the mother and fetus. It is important for us as doctors to remain vigilant and promptly recognize these conditions to provide appropriate management and ensure the well-being of our patients. Remember, this video provides an overview of the different hypertensive disorders in pregnancy. Further details and specific management protocols should be referred to relevant guidelines or senior medical staff.